Good evening and welcome to Chicago Tonight. I'm Paris Schutz.
And I'm Brandis Friedman. On the show tonight, a wild ride on Wall Street as the Dow drops more than 1,000 points before reversing course.
We've had plenty of members tell us, in tears that it's a real dilemma.
The governor vetoes a COVID leave bill pushed by teachers' unions. What's in a new compromise policy?
Meanwhile, other workers are running out of sick days entirely. We look at what protections are left as the pandemic drags on.
And we have no idea what we were exposed to. We still don't know what is in the soil a year and a half later.
Did city leaders do enough to protect Little Village residents from a smokestack implosion? A new report shares details.
McDonald's loses its bid to get a lawsuit tossed. That and other business headlines from Cranes.
Illinois dentists push for legislation that expands services as worker shortages reach critical levels.
A project to prevent invasive carp from reaching Lake Michigan receives key funding.
I actually have almost no memory of what I was thinking when I did them.
And 95-year-old Leo Segadin walks us through his series of self-portraits going back 75 years. But first, some of today's top stories. Chicago police say they are adding resources to Little Village after the fatal shooting of an 8-year-old on Saturday afternoon. Police say Melissa Ortega was shot by a suspect who was aiming at someone else as part of a gang conflict. She was taken to Stroger Hospital, where she later died.
Immediately following this incident, the department moved additional resources into the area to combat the gang violence, to target the involved gangs, and to help prevent any retaliatory shootings. Specialized units from across the city will saturate the area in the coming days and weeks to vigorously address the gang conflict that caused Melissa's death.
We've got more on this story on our website. An embattled suburban-based COVID testing company is now in the FBI's crosshairs. The FBI confirms it conducted a court-authorized law enforcement activity in Rolling Meadows over the weekend. This after reports the FBI raided the Rolling Meadows-based headquarters of the Center for COVID Control. The company has shut down its testing sites indefinitely as state and now federal investigators look into multiple complaints. Those complaints center around lax safety practices, missing test results, and social media posts by company leaders flaunting big-ticket purchases. The company reportedly received $124 million in federal COVID relief money. Activists and advocates protest former Chicago police officer Jason Van Dyke's scheduled release from prison. Van Dyke is set to get out next month after serving about half of the 6-year, 9-month sentence he received for the murder of 17-year-old Laquan McDonald. Activists today are calling for Van Dyke to face a federal civil rights investigation.
This sends a clear and direct message to every awful law enforcement officer all across the country that Jason Van Dyke is released. He is the epitome of everything that is wrong with law enforcement in our country. It ain't just about Laquan McDonald. This man had a plethora, you understand, countless of incidents with African Americans while he was on Chicago Police Department.
Chicago area Congresswoman Marie Newman is in hot water with the Office of Congressional Ethics. A report released today recommends further investigation into claims Newman offered a federal job to a campaign primary opponent. The report cites, quote, substantial reason to believe Newman may have promised the job to a challenger to garner his support. The House Ethics Committee says it will review the complaint, but notes there's been no final judgment. In a statement, a Newman spokesperson says, quote, recently a right-wing organization filed a politically motivated complaint. The materials produced during the Office of Congressional Ethics review overwhelmingly demonstrate that the ethics complaint is completely meritless. And up next, a wild day on Wall Street, so please stay with us.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
The Dow finished up 99 points today. That would otherwise be unremarkable, but for the fact it was down more than 1,100 earlier in the day. This as the markets have tumbled badly to start the year. Chief among investor fears appear to be concerns the Federal Reserve will aggressively raise interest rates to tamp down inflation. Meanwhile, the rising threat of war between Russia and Ukraine has added to the negative sentiment. And joining us now with more are Lee Baker, owner and president of Apex Financial Services based in Atlanta, and closer to home, Michael Stritch, Chief Investment Officer at BMO Wealth Management. Welcome, both of you, to Chicago Tonight. Lee Baker, what accounts for the wild gyrations in the markets today?
I think you nailed it. The thing that started it is a concern about what the Fed's going to do relative to interest rate hikes over the course of the year. Now, candidly, I think some of it is a bit of an overreaction. Yes, inflation is a problem. It has turned out to be less transitory, if you will, than the Fed initially thought going back to last summer. By this time, the anticipation was that all the supply chain issues would have eased up and we'd be moving away from that 5 to 6% year-over-year inflation kind of number. But it's still here, and it's likely to be here, in my opinion, at least another 3 months or so.
And
but
today
I think this
caps
was a
off
reaction to that.
a relatively poor start to the year for the Dow and other markets. The Dow is down 6%, the S&P 500 down 8% year-to-date, and NASDAQ 12.5%. Michael Stritch, what accounts for this performance for the first 3 weeks of the year?
Well, I think we had a tremendous year last year, a tremendous year the year before, and there is, always room for a correction in the face of a longer-term uptrend. And I think that's what we're seeing right now, and it has been driven by a couple factors. Lee mentioned, the inflation and interest rate story. We're in the middle of earnings season as well, and results have been okay, but perhaps not living up to the heightened expectations relative to past quarters. So I think that's weighing a bit on investors as well. And then, of course, as you mentioned at the outset, we do have some geopolitical tensions unfolding in Eastern Europe. But I would just reiterate that this is, although it seems extreme, and today's action was extreme, which we'll talk about, it is in the context of the broader uptrend that we've been in, something that can be, in fact, considered quite normal.
So, Lee Baker, is this a normal correction then to the hot market of the last year or so, or does it portend something more ominous like a bear market?
Yeah, so I believe this is a normal correction. I think one of the issues we've got is that over the course of the last few years, we've been lulled into a bit of a false sense of security because corrections that are normal in most years just hadn't happened, and so we'd have these little mini corrections, if you will, where, the markets would pull back 4 or 5 points, but that would only last for about a week. So having a pullback of 10% is quite normal under most circumstances. It's just that hadn't been the case for the last couple of years.
And we mentioned investor fears over the Fed possibly raising interest rates. Jerome Powell, the Fed chairman, has hinted that those might be coming. Michael Stritch, why does this make investors so skittish?
I pledge to do everything within.
Well, I mean, there's really the primary reason, I think, from the Fed's from the perspective of interest rates going up, has got to do with this idea of no better alternatives and misallocation or reallocation of funds. When you see interest rates in 1% range, and now all of a sudden at 2, maybe above 2 later this year, you start to ask yourself, is there a better opportunity in some of these fixed income instruments versus equity? So I think there is this kind of multi-asset class rotational consideration, and in particular, that's impactful for technology companies or other sort of high growth companies where you don't realize a lot of the value in terms of free cash flows and the like till well into the future. And when you see interest rates go up and you think about how equities are in effect a discounted valuation back to present day for those future cash flows, if rates go up, that challenges that long-term valuation level, which impacts technology at the margin, which is what we're seeing leading to the downside here. So that's really the risk with the Fed and inflation. I think the concern for the market is that the Fed goes too far, too fast, and rates spike too high. I think, as Lee said at the outset, we're probably at the peak sort of hawkishness perspective right now, and so we should see some of this stuff retrench in the coming weeks and months after the meeting this week in particular.
Lee Baker, what about the other geopolitical factors that you brought up? A pending military action on the border of Ukraine and Russia, the still raging Omicron variant of the coronavirus. How big a factor are these?
I think those factors are fairly large, particularly the geopolitical one with Russia and Ukraine. anytime you've got the specter of potential military action on a large scale, that makes people nervous because you don't know how all the dominoes will fall. And one of the things that we've learned through the years is that markets like certainty. Well, if you're bringing in the specter, if you will, of does this thing with Russia and Ukraine end up being something big? Does it spread to other countries? How do other countries get involved? That's a lot of uncertainty, and the markets just don't like that uncertainty. Now, on the COVID front, again, as many people hope and or believe, perhaps Omicron is the beginning of the end, if you will, to the transition from pandemic to endemic. But if there comes along another variant that is as transmissible as Omicron, but as deadly or sickening as Delta, then all bets are off.
Michael Stritch, we only have a few seconds left, but what about crypto? A lot of the cryptocurrency enthusiasts are worried about the free fall that Bitcoin and Ethereum are facing right now. Is this just part of the normal super volatility of those cryptocurrencies?
It is, and that's probably a segment for a much longer session.
Absolutely.
I would say, I put crypto with the speculative sort of technology, and there's a little froth coming out of that area of the market, and crypto is really front and center in that regard, and I expect there'll be more pressure probably in that segment in the future as well.
And that certainly is a topic for another day, and we thank Lee Baker and Michael Stritch for joining us today. Thanks so much.
Thank you for having us.
And now, Brandis, we toss it back to you.
Paris, thank you. With members of his own party controlling the legislature, it is rare for Governor J.B. Pritzker to disagree with the General Assembly on any bill that reaches his desk, especially one backed by his traditional allies in labor. But today, the governor did use his veto pen on a measure granting paid leave to teachers affected by COVID. Amanda Vinicky joins us now with more. Amanda.
Yeah, Brandis, Juan Johnny Ramos has been a custodian for 30 years. He's now the head custodian at Maplebrook Elementary in Naperville. He remembers when the pandemic first hit. It was a scary time. He was one of the few people still actually going into work, and as soon as he got home, he'd change his clothes. Now, fast forward 2 years later, earlier this month, he did get COVID. And even though he's vaccinated, it hit him hard. He couldn't return to work for another 2 weeks.
Once you got hit with it, then you would really drained and try to get your ability. You know how much you have to do in this job every day and how long it takes you. It's like a triathlon. I mean, there are days where we do 30,000 steps easily.
He had already used all of his sick days due to a hand injury, and so in order to keep on getting paid, he had to dip into his vacation time. Now, these are the situations that the measure that Pritzker vetoed was meant to address. It gives teachers unlimited paid leave for COVID-related absences.
We don't want people to come to work sick. And that's what happens. A lot of people are faced with a really terrible dilemma. You're sick, or you're in isolation, or your child is, and you have to stay home for 5 days or whatever it is, but you have no sick time, which means you're not being paid. So this says, look, we'll make sure that districts pay them.
But the measure was opposed by various education organizations, the State Principals Association among them.
We're trying to prioritize in-person learning. You have to have people to do that. So we were concerned about what this would do to the ongoing teacher shortage, ongoing substitute shortage, and being able to maintain, enough classrooms to maintain in-person learning.
John Berkey is a former school superintendent, and he is now with the Large Unit District Association. He says that he understands that many early career teachers, as well as bus drivers, paraprofessionals, and other support staff may not have a lot of sick time or even vacation time accrued. But he says this is a measure that passed the General Assembly way too quickly without enough discussion, and he says he doesn't like that it doesn't have limits.
We don't want that to happen to say a first-year teacher to run out of sick leave and then not be able to get paid because you're home with COVID. So I think we just need to be able to talk about how can we put some reasonable limits in place. We're concerned also the bill is retroactive to the beginning of the year. So every sick leave day that's been given for anything related to COVID is going to be given back.
He says that a new compromise that was reached between the governor and the teachers' unions is an improvement, but still on a bad bill. The new plan is nearly identical to the one that the governor vetoed. Educators from elementary to those who work at community colleges and the state's public universities, as well as support staff, will get paid leave if they cannot go to work because of COVID, whether it be because they have it, because they have to quarantine, or because they are taking care of a child who has the coronavirus. Now, the update, this is only something available to those who are vaccinated.
If you are fully vaccinated and you've been wearing your mask and you are identified as a close contact, you don't have to quarantine so long as you don't have symptoms. So that ensures that a teacher or a staff member who is in that situation can still come to work. They would not have to be quarantined or take time off.
This new agreement was just introduced this afternoon, so Maley's principals organization does not yet have a stance on it. But the IFT president says that this compromise with Pritzker is good public and good public health policy.
Once this is enacted, it will give people a time window to get vaccinated. And we think that's a just and fair thing to do. And in fact, it helps to make this a good incentive.
Good incentive to get vaccinated. Now, by the way, this measure is only good for this school year. And again, not for any other health issues, only if somebody cannot go to school to work because of something related to COVID. The deal does mean that the governor is going to avoid a sticky election year tussle with one of his allies. Of course, that is teachers' unions. This compromise is likely to pass the General Assembly when it goes before the legislature. It, by the way, is unclear how many teachers have unused sick time that they would have to resort to something like this, and how many have a lot in the bank. Both teachers also say that a majority of their members are already vaccinated. There's a lot of controversy here, Brandis, including those who ask, why limit this policy to only educators? Back to you.
Amanda, thank you. In the first half of January, an estimated 8.8 million U.S. workers reportedly stayed home, either because they were sick with COVID or caring for someone who was sick. According to Stacia, this is not only an increase of over 2 million people year over year, but also the biggest workforce shortage since the start of the pandemic. This comes as some workers are running out of sick days from their employers. Here to discuss this and more is Jorge Mujica, a strategic organizer for the community labor advocate organization Arise Chicago. Jorge, welcome back and thanks for joining us. So when employees have to take off for COVID-related sickness, how are they impacted?
Well, with a loss of income to start with. In some cases, employers take vacation time as sick time. I know vacation and sick time is not the same thing, but legally they are authorized to do that. So in those cases, you may get paid, but it also depends on how many vacation days you have. If you have 5 days a year and your disease, your sickness lasts 10 days, then you would lose 5 days at least. I think that's the general denominator, loss of income.
Right. And then what about the employers themselves? How are they impacted?
Oh, well, the employers, of course, get impacted because you are not producing. You are not making money for them. So obviously, they don't want that. We have seen many cases workers have denounced that employers are forcing them to go even when they test positive. They say, if you don't have any symptoms, just come over and keep working as if nothing had happened. That's incredibly dangerous from the health point of view, too.
Now, earlier today, we spoke with a factory worker who took unpaid leave for 5 days because she needed to care for her 3-year-old son who tested positive for COVID. Here she is.
Yo tuve a mi hijo que dio positivo y estuvo enfermo, estuvo con fiebre como 3 días más o menos. En cuanto me enteré, pues obviamente le dije a mi supervisor que pues mi hijo había dado positivo. Pero yo no. Pues nada más dijeron, pues como yo no tuve COVID, pues esa es la razón de que no me van a pagar, porque anteriormente yo había sabido que sí pagaban si un hijo salía positivo, pero en este caso, pues supuestamente ellos ya las reglas ya cambiaron y ya no están pagando.
Now, Genesis Mantuano, they are saying that her employer told her that because it was not her, it was her son who had tested positive, that they would not be paying her for the sick time that she had taken. Jorge, explain to us what the situation is currently like for workers when it comes to sick days. Are you still hearing from a lot of people who need to take time off because of this Omicron surge?
Definitely, yes, more than ever before. And people have in mind that in 2020, you got paid for your quarantine up to 80 hours if you got sick or if your relatives got sick. But that ended in December of 2020. There was a small extension to March of 2021, depending on if the employer wanted to pay you. But people still have the idea, so they are still asking employers to pay for their quarantine, and employers are flatly, denying that petition. So that's what we're seeing. Not only workers getting sick, but their family getting sick. And if you have two small children, your nanny is not going to be taking care of two sick children. She's going to stay away, so you have to stay home to take care of them.
And of course, that is for people who are fortunate enough to have a nanny. Now, at the end, Genesis there was referring, and you as well were referring to the Families First Coronavirus Response Act, which used to require employers to provide paid sick leave to employees who are unable to work due to COVID-19 related reasons, including caring for sick family members. You mentioned that extension, but that ended in March 2021, so that's nearly a year ago, back when the vaccine became widely available. Has there been anything to replace this since?
Not at all. Absolutely not. Chicago and 22 cities in Cook County have the what is called the earned sick days. You earn sick time as you go working. But that starts on calendar year. Starting on January 1st, for every 40 hours you work, you accumulate 1 hour of paid sick leave. But that means that so far, in these 3 weeks, you have accumulated like 45 minutes of paid sick leave. By the end of October, you will have full 5 days. But that's if you don't get sick before. So that doesn't cut it. And that's the only provision there is in the land for paid sick leave.
So there are no other protections then for employees who don't have the remote work option?
No, unless you have a collective bargaining agreement, with a labor union, then maybe you get it. Or you get paid vacation, and so you take your vacation time as sick leave.
Jorge, do you foresee, any new law or mandate in Illinois soon that could, given especially, these recent surges with Omicron, anything else that's coming that can protect workers?
Nothing at all. And the situation is even worse because of that CDC 5-day notice thing. Employers are telling people, oh, after 5 days, you come back to work. Don't even get tested anymore, because the CDC say 5 days, so I want you back in 5 days. And nobody I know of is working on extending paid sick leave to anyone in Illinois.
Okay. And quickly before we let you go, Jorge, anything that employers can do to better protect their employees?
Well, of course, comply with all the precautions in the workplace. Be careful to watch that everybody wears a mask, vaccinated or not vaccinated, that everybody wears a mask. If possible, to still keep social distance, do it. Wash your hands every so often. Scattered shifts, so not everybody gets at the same time trying to punch in. 10 workers by 10 workers by 10 workers every 5 minutes, something like that.
Yeah, continuing to maintain some of the practices that we've all had to put in place over the last couple of years. Jorge Mujica at Arise Chicago, thank you so much for joining us.
Thank you.
Up next, an Inspector General report found those responsible for the Little Village Smokestack implosion haven't been held accountable. Reaction to those findings right after this.
There are renewed calls by Southwest Side residents for action from the city over the Smokestack implosion that spread a cloud of dust over Little Village almost 2 years ago. This after a new report from the Chicago Inspector General's office concludes city employees and the company involved should have faced tougher consequences for a lack of oversight leading up to the demolition. Chicago Tonight's Joanna Hernandez spoke with residents about this new report and issues that go beyond this one event.
Kind of a big, whatever to the people that live here, like who cares? I know that even before the plant got taken down, a lot of the residents developed upper respiratory issues.
This is an image residents of Little Village may never forget. Gaspar Mesias lives right next to what is now a Target warehouse and watched the massive shadow of dust blanket the neighborhood.
Sé que si ellos cobraron miles de dólares de multas y la gente que vivimos aquí, pues aquí no nos tocó nada. Y aquí, si usted ve, aquí donde está aquí, en mero frente estaba la torre.
In April 2020, Hilco Development Partners demolished the former Crawford power plant. Neighborhoods on the southwest side were left to deal with the aftermath. Now, an investigation by the City Inspector General's office contends that the Department of Health should have terminated one official, and the Department of Buildings should have disciplined 2 others directly associated with the implosion. That has not happened, but to some, simple employee discipline would not be enough anyway.
Be accountable to the actions that you did. Firing somebody is not going to tell us what's in the soil. Firing somebody is not going to fix the fact that individuals chose to not give information. Individuals chose not to follow up on things, and all they get is a reprimand.
Kim Wasserman, executive director of the Little Village Environmental Justice Organization, was one of many who tried to stop the demolition. Now she wants the mayor to release the full Inspector General's report.
We have no idea what we were exposed to. We still don't know what is in the soil a year and a half later. And so I think that's what Hilco needs to be putting up money for with the city, is to tell us what were we exposed to. Can we do anything about it? Hilco should be putting air filters in every single person's home that was in that area. There's more trucks because of their development. They need to be responsible for that and so much more.
The report found those in charge had more than enough warning of potential hazards, in fact 213 days before the destruction of the power plant, and said that toppling the smokestack would be a disaster.
I think the IG laid out what potentially that would be, and I think the city's fallen short so far.
The report is critical of the oversight of the project leading to that day. It claims officials of the Department of Public Health and the Department of Buildings approached their regulatory roles and responsibilities in not-my-job fashion, rather than taking affirmative measures to meet the public health and safety risks at the core of their respective departments' missions. Alderman Michael Rodriguez of the 22nd Ward says the report leaves him wanting to know more.
My neighbor's been fighting against a former polluter that was there in the energy company. Now they've had this dust storm on them. What's been given so far has not restored the justice that's deserved to the members of my community, to my neighbors, the people who live down the street from me.
The report by the Inspector General concluded by claiming city officials ignored the red flags and information provided to them that the demolition posed a high risk of environmental harm to the neighboring Little Village community, calling out the city for poor public administration and negligent dereliction of regulatory responsibility. So far, a Department of Health official has been reprimanded, and the Department of Buildings has claimed employees did not violate any rules.
As a matter of fact, I don't know if they'll ever be able to do enough to restore full justice to our community. Hilco needs to do more. I thank them for giving Access Health some resources.
In a settlement, Hilco and its subcontractors were required to pay $370,000 that will go to Access Community Health Network to support a project called the Little Village Community Health and Wellness Program. Hilco and its contractors were also hit with multiple citations, resulting in $53,500 in fines. But for activists like Wasserman, this is just the beginning of a long road ahead.
The scars of what that day has done to our people is no amount of money can fix what happened that day. But best believe that we're going to continue fighting for our neighborhood because we are worth it.
For Chicago Tonight, I'm Joanna Hernandez.
We reached out to Hilco for comment, but they have yet to respond. The Chicago Department of Public Health says it has adopted new policies for future implosions, but disagrees with the Inspector General's findings with regard to any employee acting in a negligent manner. And thus far, Mayor Lightfoot has declined to release the full Inspector General's report. And now, Brandis, we toss it back to you.
Paris, thank you. Still to come on Chicago Tonight, a Chicago-based bank is pulling out of a pro golf sponsorship. That and more business headlines from Cranes. Illinois dentists are facing worker shortages amid the pandemic. What is the dental community doing to fill the gap? Preventing invasive carp from reaching the Great Lakes. A key project receives nearly $226 million in funding. And an Evanston-based artist looks back at some of his life's greatest work, portraits of himself. But first, some more of today's top stories. Local and federal leaders celebrated the CTA's L overhaul. Officials gathered this morning for an event heralding the red-purple bypass, which opened in November and eliminates a choke point where red, purple, and brown line tracks previously intersected. It was the first major achievement of the CTA's $2 billion red-purple modernization effort, which also includes a major rebuild of tracks and stations in Edgewater, Uptown, and in Lakeview, which got a ceremonial groundbreaking this morning. The full red-purple line overhaul is scheduled to run through early 2025. Aldermen eye another payout, this time for two men convicted based on coerced confessions. Those confessions were obtained by detectives who trained under disgraced former police commander John Burge. Kevin Bailey and Corey Batchelor were convicted for the 1989 murder of a retired police officer's wife. Bailey spent 28 years in prison and Batchelor 15 years. They were exonerated in 2018. The City Council Finance Committee approved a measure to pay the men $14 million. The full City Council is expected to vote on the settlement Wednesday. And now to Paris for some of today's top business headlines. Paris.
Thanks, Brandis. McDonald's faces a lawsuit that claims systemic racism in the company's practices. A Chicago-based bank is pulling out of a pro golf sponsorship after 14 years, and the luxury home sale trend for 2022 is looking quite luxurious. And here to go behind the headlines is Crane's Chicago business editor, Ann Dwyer. Ann, great to see you as always. So recently a federal judge denied a request by McDonald's to toss a discrimination lawsuit. Remind us what the stakes of this lawsuit are and what's next.
Well, McDonald's has been trying to get out of this lawsuit for quite some time, Paris. And the reason why is I think they regard it as something of a nuisance, but it's actually priority number one, it seems, for Byron Allen, who is the media mogul who happens to own a number of enterprises, including the Weather Channel. And he has alleged for quite some time in several different filings that McDonald's is investing an infinitesimally small fraction of its marketing budget in Black-owned media. He claims he has evidence to support that assertion, and he's been suing McDonald's for quite a while to try to have his day in court. Now, this was a procedural motion today that was denied by the federal judge overseeing the case, which means that both sides will have an opportunity to file again. So we'll be watching it closely.
So this case will go on. All right, next story. After 14 years, Northern Trust Bank is pulling out of the pro golf tournament sponsorship game. And mind you, this is right after it sponsored the 2021 Northern Trust tournament in New York.
Right.
So how come they're pulling out?
Well, they say basically that they feel that they've gotten what they wanted out of this partnership. And you know, think about the audience for professional golf and the market for Northern Trust's financial services. They cater to a very wealthy, often family clientele. And I think that they felt like the PGA was a great marketing fit for them at a time when they were really trying to raise their profile, especially in the money management business. And it appears that they feel content with what they got out of that plan, and they're going to direct the money that they do have for marketing in other directions.
Certainly, those sponsorships can be costly. And lastly, stock market has had a rough ride, but that is not extended to the luxury home market in the area. Cranes has reported some very intriguing high-end home sales. Tell us about those.
Yeah, the high end is just on fire right now, particularly in the city of Chicago. Just today, Cranes reported on a $6.5 million mansion sale in the Graceland West area. It's the second sale in Chicago at or near that price point since just the beginning of the year. The suburbs are hot too, not quite as hot yet as Chicago, but even farther afield beyond the suburbs. Today, we also got news on a massive home sale in Lake Geneva, just over the border. The Richard Driehaus estate, which has been on the market for a while, we reported a few weeks back that it had sold for $36 million. Today, we learned the buyer is none other than Chris Reyes and his wife, Ann, who purchased the property. Chris Reyes is one of the co-founders of Reyes Holdings, a very large beverage supplier.
All right. Ann Dwyer, thanks so much.
Thank you, Paris.
And now, Brandis, we toss it back to you.
Paris, thank you. The pandemic has forced all kinds of workers to adapt, and that includes various medical fields like those in dentistry. As dentists across Illinois experience staffing shortages and an increase in dental appointments, they're asking state officials to consider teledentistry and other services to help meet the demand. Joining us now with more are Dr. Scott Tomar, a dentist, professor, and an associate dean for prevention and public health services at the University of Illinois Chicago's College of Dentistry, and Dr. Kirk Narayan, communications chair of the Illinois State Dental Society. Thanks to you both for joining us. Dr. Tomar, let's start with you, please. Dentists across Illinois, we know that they are experiencing a staff shortage amid this pandemic. Have you yourself experienced that, and how are you handling it?
Yeah, it's affected not only private practice dentists, but it's something that we're experiencing in the College of Dentistry, and I know most of the federally qualified health centers that we work with are having the same struggles. I think that there's no magic bullet to solve this, but I know our organization and others are trying all kinds of interesting and innovative approaches. Everything from starting their own dental assisting programs. In the college, we're starting an internship program, trying to bring folks into dental assisting to help us with our acute staffing shortage.
And you said that the college is experiencing the shortage as well. How is it affecting them? How you all there?
Well, it's creating the same problem that private practice dentists are having. That we currently have a shortage in many clinics of dental assistants. So it just slows things down, and our student dentists are not able to work as efficiently when we don't have adequate support staff. So again, we're trying a number of innovative things to try to bolster that.
And Dr. Narayan, your organization is calling for legislation that introduces teledentistry. First, tell us how that would work.
Well, there's basically two main changes that we're looking to propose here. One is to expand the use of teledentistry, and the other is to address the workforce shortage issue. So when it comes to expanding the use of teledentistry, we're looking to have the dentist be able to delegate limited care to dental hygienists and dental assistants while maintaining high patient safety standards, and also addressing the workforce shortage by allowing dental assistants to provide more patient services under the direct care of a licensed dentist after receiving approved training.
Now, we know that there's been some concern about that from opponents, that it might be difficult to do this. How do you respond to that teledentistry is effective?
Well, first off, we're advocating for people to have the appropriate level of training to be able to offer these services. So when it comes to like a dental assistant being able to offer some of these services, we're looking at, them going through some type of continuing education program that's approved, or going through a dental assisting training program that's approved by the Council on, the Commission on Dental Accreditation of the American Dental Association, or programs approved by the Illinois Department of Financial and Professional Regulation. So basically, we're looking at being able to have appropriate staff trained to be able to accomplish these procedures.
Now, according to a 2021 study from the American Dental Association, about 86% of dentists said recruitment of dental hygienists was challenging, and about 83% of dentists said that recruitment of dental assistants was challenging, and more than 70% said that recruitment of administrative staff was also challenging. Dr. Narayan, based on your organization's research, what have you heard from dentists about the recruitment process?
Well, it's really quite challenging right now across all aspects of dentistry. In particular, we're aware that 5% of dental hygienists have left the practice of dental hygiene, and they have not returned to work.
And Dr. Tomar, today, Illinois U.S. Senator Dick Durbin urged healthcare providers, hospitals, universities to publicize this $1 billion scholarship and loan repayment program for workers entering these fields where there are shortages and limited resources. How could that help dental workers and with recruitment and staff?
I think it's certainly a step in the right direction. There's a national program, the National Health Service Corps, but state program, adds to that. I'd say, it certainly helps us try to recruit dentists and dental hygienists to underserved areas. But I think we really have to go beyond that. One of the things that we see in Illinois is, at least in terms of the number of dentists, we're actually fairly well supplied, but we have about the 11th highest dentist to population ratio in the country. But we still have 75 of the 102 counties in Illinois that have a dental health professions shortage area. So part of it, I think, has to do with recruitment as well as providing scholarships and loan repayments. We have to try to recruit people from areas that are underserved with the hope that they return to those areas to provide care.
And Dr. Narayan, before we let you both go, what more would you like to see maybe from policymakers or the government to support what you all need in about 20 seconds?
Well, I think the biggest thing is for us to really get this bill passed through the Senate and the House. We really need to expand the scope of teledentistry to get the access to care moving along, and also to help alleviate some of the stress on the system right now by trying to utilize teledentistry whenever we can.
Okay. Dr. Kirk Narayan and Dr. Scott Tomar, thank you so much for joining us.
Thank you, Brandon.
Thank you.
And now to Paris and new funding in the fight against an invasive species. Paris.
Brandis, they're the unwanted invaders that have cost billions to keep away. The latest effort to keep Asian carp out of the Great Lakes is getting a $226 million federal boost. It'll go toward planning and engineering of the Brandon Road Lock and Dam invasive carp barrier. But much more funding is required to finish the project. Last month, a coalition of Great Lakes governors, including J.B. Pritzker, signed a letter stating they were tapped out and needed the federal government to fund the project. And joining us now to discuss the threat invasive carp pose and the Brandon Road project are Colonel Jesse T. Curry, commander of the Rock Island District of the U.S. Army Corps of Engineers, which is where the dam and lock is located, Mark Smith, Great Lakes Policy Director at the National Wildlife Federation, and Margaret Frisbee, Executive Director of Friends of the Chicago River. Welcome all of you to Chicago tonight. Mark, I'll start with you. Our viewers are very well aware of the problem of invasive carp, but remind everyone the threat that they pose to the Great Lakes.
Sure. Well, invasive carp are essentially a big threat to the Great Lakes, and they're a big threat to a lot of the waterways in our country. They were brought in to the country in the late 70s, early 80s to eat the algal ponds in the south, and they, through flooding, got into the Arkansas River, got into the Mississippi River, and eventually swam their way further north up into the Illinois River, up into Peoria, and are at the gates of the Great Lakes. And the big problem with invasive carp that we know about is that they outcompete all the native fish that we really care about. So the game fish that we fish for, the smallmouth bass, the panfish that the kids catch, that is at risk because in certain stretches of the river systems up in and around Peoria, invasive carp can accumulate to almost 90% and above of the fish biomass in certain stretches. So they just outcompete, they eat all the food sources. And then as we know, if you go on YouTube, you can see them jumping out everywhere. So threat is real. We don't need them in the Great Lakes. We have a $7 billion sport fishery, a $15 billion boating industry. We don't need these in the Great Lakes.
And Margaret Frisbee, they're knocking at the door of the Great Lakes. They have been for many years, but they're everywhere in the Illinois River, especially down near Peoria. How have they changed the biodiversity and the ecology of the Illinois River system?
Well, the fact is, like Mark alluded to, they can present 90% of the fish in the river system can be Asian carp, invasive carp. And so they're outcompeting the fish. They scoot along the bottom. They can destroy habitat for native fish. And it's not just the Illinois River. The fear is that the Chicago River system, the Calumet River system, and rivers all the way around the Great Lakes would be infested with these creatures. And so we're really determined to use all the techniques at our fingertips to stop it.
And Colonel Jesse T. Curry, as we mentioned, the feds have come through in this infrastructure bill with $226 million for the Brandon Road Lock and Dam. Tell us how this project will work.
Yes, Paris, thanks. As this latest investment stands as a significant milestone for this particular project. The U.S. Army Corps of Engineers, and specifically the Rock Island District, has been working for more than a year at the pre-construction engineering and design. And what this funding does is it gives us the ability to start driving forward towards actual construction. So as they put together the features of this particular project, we are working to develop this layered defense against this invasive species that, again, will help protect the ecosystem and the biodiversity in the Illinois River.
And Mark Smith, despite that big chunk of federal money, that might only make up about a quarter of the funding that will ultimately be needed to finish this. So where will the state get that funding?
Well, that's the question. And the good thing is that with last week's announcement that the federal government will pick up the bill for the first year of construction, that's very helpful, make the project be seamless from the end of the design phase into the first year of construction. The problem is the non-federal sponsor, in this case, Illinois, would have to come up with the remainder of the percentage of the cost. So I think the big picture here we really need is that this is not an Illinois problem. It's really not a Great Lakes problem. It's a national problem. And all the more reason why the federal government really should come in here. It's a multiple district, multiple state, multiple jurisdictional problem. Perfect role for the federal government to come in and cover the entire cost, because this is a national issue, and Illinois should not be the full, just because it's in their state doesn't mean they have to pay the full price to this. And there's precedent for this. Projects like this are paid for by the federal government. So this is consistent with previous projects.
As you mentioned, Michigan has jumped in with some funding as well because it affects all the Great Lakes states. Margaret Frisbee, will Illinois be able to keep Asian carp out of the Great Lakes without the completion of this project?
Well, I think not. I think this project's imperative, and smart technologies that we know can work against aquatic invasives are imperative. We've seen so much recovery of our river systems. The Chicago River system, for example, had 7 species of fish in the 1970s. Now we're nearly up to 80. And we want to make sure that we're protecting all of our water environments equally. And this is a really good way to do it. There's other techniques, we've talked about fishing the carp out for fertilizer, for food, but we really need to work on keeping them out altogether in really determined fashion, like the Army Corps has proposed here at Brandon Road.
And Colonel Jesse, take us inside the technology used at Brandon Road. How does it keep invasive carp out, but not other species of fish that are welcome to swim to the Great Lakes if they so choose?
Yeah, thanks. That's a great question, because where we currently stand in engineering and design is evaluating a variety of different technologies, from electric barriers to bubblers to acoustic deterrents, and determining how in this nationally unique project, those working together can reduce and eliminate the ability for the invasive species to make it through a particular location like this. So we're still working through that science, and we certainly are respectful of the urgency to get that science complete so we can start getting it into the actual lock and dam and building that layered defense that we spoke about earlier.
Mark Smith, is there a consensus in the wildlife community or the science community in terms of which science works the best here?
Well, yes and no. The beauty of Brandon Road that it's actually is going to be an experimental project that we can actually put in different types of technologies and see the effectiveness of it. I mean, as the Colonel mentioned, it's a layered approach. You can put in multiple deterrents that add up to a large effectiveness. And some of the lock and dam projects, acoustic sounds in the river systems that are being used in Kentucky, for example, could be brought up to Brandon Road. and vice versa. So the Corps really has an opportunity here to use this project as a testing ground, a pilot program, if you will, to deploy in other parts of the country to keep back invasive species. So it's a really, really unique and needed project.
And Margaret Frisbee, very briefly, you mentioned possibly commercial fishermen fishing them out, people eating them. How helpful would that be?
Well, you know, DNR, the Illinois Department of Natural Resources, has paid fishermen. They have tried to build markets. And that's certainly a tool in the arsenal, but it's not something that we want to rely on. You know, these fish are healthy. They're good for you. We should be eating them. We should all be eating more fish anyway, right? So there are local efforts, but we want to make sure that we use every single technology at our disposal. And, you know, I, for one, we've Friends of the Chicago River, we've tried to educate people about Asian carp, and we've held Asian carp grills on the Chicago River Walk downtown so people can try it and build awareness and, you know, maybe think differently about these fish. But we just need to make sure that we're doing everything we can and not just relying on one technique.
All right, and we've reported here at Chicago Tonight on the statewide effort to change the identity of the Asian carp, change the name to make it more friendly for people to want to eat them possibly. So a lot of tools here, as you mentioned, Margaret. And our thanks to Colonel Jesse T. Curry, Mark Smith, and Margaret Frisbee. Thank you so much.
Thank you, Paris.
And up next, a series of one-man self-portraits spanning 75 years. But first, we take a look at the weather.
For the first time, self-portraits of artist Leo Segadin are on display in a solo exhibition. Chicago Tonight's Jay Shefsky first introduced us to the Evanston-based artist some 10 years ago. Arts correspondent Angel Ito takes us to the Displays exhibit showcasing the series of self-portraits spanning 75 years in a new interview with the 95-year-old artist.
This is Leo Segadin. This is also Leo Segadin. This is Samir too. In fact, they're all Leo Segadin, all painted by the artist himself over the course of 75 years.
But the past is my present, in my painting anyway.
Jay Shefsky first introduced us to the artist in 2013. While a lot has changed since then, some things have remained the same.
I grew up on the west side of Chicago, okay? Anytime I paint a city now, it's from the west side of Chicago from 1940s.
Despite raising his family in Evanston for the last 50 years, Segadin's work has always been rooted in his childhood memories. And while age has forced Segadin to relocate his studio space at home from the top floor to the living room on the first floor,
now I'm down here in my studio. Look at that, for crying out loud. That's a studio?
his drive remains the same.
What most artists do is bullshit. Pardon the expression. I think since the beginning that my paintings had to be about something. It had to have a subject, and it had to be an important subject.
Those subjects are now on display in an exhibit at the Oakton Community College.
What are some of your favorite self-portraits that you see in the exhibit?
There's one that used to hang here, in which I am 3 times. And I've seen it here every day, but when I saw it in the museum, I said, wow, did I do that? One of the paintings that's in the show, actually, it shows a kid with a helmet, you know, and then an old man with a beard. And that's me when I was 9 years old and I wanted to be a pilot. What would I think I would be, say, when I was 95 years old? And now that I'm 95 years old, I wonder, what did I think I was when I was a kid, you know? And this confrontation, that's what the painting was about.
With no help from a mirror, Segadin paints who he has always known himself to be, not necessarily who he sees.
I actually have almost no memory of what I was thinking when I did them. I look at them and I almost project the past into them.
Segadin says he doesn't paint to please people, but hopes his work does. It's for that reason Segadin says he doesn't believe his style is describable.
I don't think you can explain it in words. I don't think a visual image is translatable.
What is it that you want viewers to take away from you and your work and what they interpret?
Be aware of me as a person that lived for a long time, that produced, and as long as I can, I will. So I may go back to the more spontaneous stuff and just pull it out. And it'll be real loose and no edges and all that. I'll see what happens.
Is that intimidating?
Yeah. Yes, it is. That's a good question. I'm scared. Advice to young people is do it where you can. There's only one material that's irreplaceable, and that's time.
For Chicago Tonight, I'm Angel Ito.
Again, those portraits can be seen at the Cone Line Museum of Art in Des Plaines through the end of the month. Segadin's next exhibit is scheduled for this spring at an art center in Evanston. And we're back to wrap things up right after this.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
And that's our show for this Monday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news.
You can also get the show via podcast and the PBS video app. And please join us tomorrow night live at 7. A proposed settlement for 2 men affected by disgraced police commander John Burge's confession methods.
And fewer students are enrolling in college. We talk about what's behind the decline. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman.
And I'm Paris Schutz. Thank you so much for watching. Stay healthy and safe and warm, and have a great night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that supports free educational initiatives in the legal profession.